talking about compassion and AI. Oh my goodness. Stephen Butler is here. Um, and I was so excited when I was talking to Stephen actually yesterday, and I was so excited, Stephen, to hear that you were willing to come join us. Um, and I want to share a little bit about Stephen for everyone. That's part of this relay. So Stephen Butler is executive director of the Compassion Institute, and owner and executive producer of Buffalo Jump Records, which specializes in Native American and indigenous music. With 27 years, over 27 years at Canyon, Stephen has produced 230 plus recordings, including 21 Grammy nominated and 14 award winning albums, notably producing our Carlos Nakai's 4+ million album sales. You're also co-founder of A Skeptic's Path to Enlightenment podcast. Um, thank you for bridging Indigenous culture, Buddhist meditation, and compassion training, developing programs for individuals, institutions, and communities promoting global well-being. Stephen, thank you so
Oh,
much for joining us on
oh,
this.
Ani, thank you so much for having me. It's a joy and
Oh,
an honor to be here amongst all of you.
Oh my goodness. So, I told you that, we have this AI plus compassion relay that started in Osaka, and we've been following the sun around the world. So thank you for dropping into our sunshine right now. And Stephen, oh my goodness, there's so much we can talk about, but can you kind of share a little bit about compassion and why is compassion so important for us to be talking about at this moment in time?
Oh, Ani, yeah, thank you so much. Yeah, I mean, compassion really it is a core essential part of humanity. So from the moment, the instant we come into being, we are completely dependent on other, the people around us, their natural capacity to attend to our suffering and our needs. This is a wonderful, I mean, it really begins with the definition of compassion itself. Both contemplative traditions over the years and neuroscience have agreed that compassion is the feeling that arises when witnessing another person's suffering and that moves us into a motivation of a subsequent desire to help. This distinguishes it from empathy, which refers to the vicarious experience of another's emotions. So, compassion at the very level of the ground is one of the most basic um, human instincts we have. And whether we're calling it compassion or not, we are receiving compassionate action from the moment we come into being. So, at the core, it's there from day one, from instant one. Our mothers are tending to our suffering, they're aware of our suffering, and they're moving to go beyond that suffering and to remove it. So at the very beginning, it defines us as a human being. You know, the His Holiness the Dalai Lama, which has done so much amongst others, like the Bishop Desmond Tutu, Mother Teresa, so many others who've brought compassion out. The Dalai Lama, in particular, has really helped bring this word into the public vocabulary and the public discourse. He's always said kindness is society, meaning the very fact that society is functioning at all is a byproduct of our essential capacity to be kind and to care and remove the suffering of others. Otherwise, it would collapse much more than it. And I know it seems like it's collapsing so much these days, but it would collapse at a much greater, to a much greater degree if we weren't tapping in to this essential human quality of compassion. So it's there from day one.
So, so just so that we all understand, um, compassion is here the moment we arrive. And 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 what I love, Stephen, is you also, you back quite a bit up, from a science perspective, just so that people understand that, this is a field that has been studied quite thoroughly, that you help bring into the world through Compassion Institute. How do you see compassion as a necessary force, a necessary driving force or element for humanity's survival when we're really looking at the age of intelligent machines and artificial intelligence and where we are today?
Yeah, you used a beautiful word there, Ani, which is survival. And I'll reference the Dalai Lama again. The work of Compassion Institute is completely secular. It's born out of the Dalai Lama's desire to bring the fields of science, of neuroscience, psychology, and contemplative practice to come to bear on the greatest problems that humanity experiences. So it's there's contemplative roots in there, but it's rigorously evidence-based. But quoting His Holiness again, you've he's equated compassion with survival itself. And I think recognizing the primacy of compassion at that level is really key. At the level of the ground, in terms of defining what how we interact with AI, with technology, with it could be anything, but equating it with survival as the best survival strategy is very key. Compassion is relational. At the level of the ground, it's not about feeling, it's not simply cultivating a feeling or experience of compassion in oneself. That is entirely dependent on the other. So, and what's key about it is the distinction from empathy. Going back to the neuroscience of it, we can see empathy is needed for compassion to be aroused because that's the basis of how we connect and care. We see the suffering we experience, we immediately connect with that at human level because we all want to avoid suffering and migrate to happiness and peace. So we immediately connect at that level. But what compassion does is it gets into motion. Empathy is the biological state of feeling the emotion. fMRI studies show that empathy for suffering alone activates the amygdala or fear center, and it can result in shutting down if we reside in that state too long. Compassion, and quite often empathy and compassion are kind of conflated, but compassion is a byproduct of what can we do about it? How do we then begin to relate to the world and the suffering and the experiences around us from the frame of reducing the suffering of others? Now, the, the alchemy of compassion, and this is also backed by science, is when we attend to the suffering of others, we begin to attend to the suffering in ourselves. Why? Because of that deeply held connection we have as humans that we both want to move beyond a state of suffering. So
Mm.
when people who are compassionate tend to be very light, they tend to be people who can migrate from very stressful situations, difficult situations, but move immediately to an area of resiliency and lightness. So we see that as a byproduct of compassion. Um, so I think building that in at the level of the ground, seeing it as a survival strategy is very key for bringing this in the spaces that you and these wonderful folks in the room are into merging it with the technology that we all have to embrace and we're all going to rely on. So having it at the level of the ground, giving the primacy of survival is key.
Yeah. I couldn't agree with you more, Stephen. And there's so much that we can talk about with the work of the Institute. I'm hoping that you can share a little. I know there's a very exciting project that I heard about from you yesterday that you will actually be taking a group together um, to actually present to His Holiness Dalai Lama. But can you tell us a little bit about? I don't know how much you can share or not, but
Sure.
as an example of the work, this important work, especially now that you're doing to help promote compassion with others.
Absolutely. Yeah, one other thing I'll kind of mention as a bridge from what I shared before is compassion is pro-social. So I think dialing into the pro-social components of compassion at the level of the ground and developing the technologies is really going to be of benefit because it's acknowledging the fact that we want to be connected. We have a
Mm,
human need for connection. And so acknowledging that in a meaningful way, in an embodied way at the level of the ground will be key. Those last two words, meaningful, embodied. I think the work of the Institute has really been over the last several years in getting to a greater level of how do we see compassion not just as a means for individual transformation, whether it's mindfulness or compassion or any other well-being kind of intervention, all of these kind of work together. But we can learn about compassion. I can learn the basic tools of compassion. Compassion is a muscle, it can be trained. When I learn those, I can train that muscle. But what is it like to be within a system where compassion is not firmly situated as a core value or as a ecosystem value? Then you can get into some very challenging areas because while I'm cultivating compassion within myself, I'm being placed into a system where compassion is not situated to support my journey. You then begin to get a bit of a systemic breakdown. Um, we saw this in the pandemic. We deliver a lot of programs to public health workers and in healthcare, in caring professionals, law enforcement, public safety, educators. We made a move at the Institute several years ago that if we were going to bring this in societally, going beyond just individual transformation, we need to get in at a more tectonic level. And why not do that with caring professionals who have tremendous touch points within society? What we realized and learned was that if the system is not acknowledged and if compassion is not brought in at a systemic level, you can achieve a degree of change, but you will not permeate the culture. So the institute right now is poised to, with partners in key areas in public health, we now have the ability to go in and create and evaluate and demonstrate a replicable model of compassion as a organizational catalyst for culture over a multi-year period with two healthcare organizations that can be replicated and scaled. I feel going back to story when I joined in, you spoke about storytelling. What's really needed at this point is that story that compassion can be the cultural catalyst and the cultural shift that we need. It's not new, but if we dial into it in a more meaningful and embodied way, we can see staff retention go up. We see frustration with an organization in a public healthcare system actually increase, or excuse me, decrease. So to the point where the frustration is better than the national average. We see healthcare workers and professionals more deeply connected to their sense of purpose, which fulfills their covenant for wanting to show up each day to work. The beneficiaries of that is society itself. In a healthcare system, it's those receiving the care, it's the families who are supporting those receiving the care, it's the entire community. And more importantly, we allow the best of us to be
mm,
resourced inwardly to stay in the game longer. Burnout and is a massive problem. It's an epidemic globally. But what we've seen, compassion research has shown that it can greatly reduce burnout because we move out of empathic distress into a position of agency, of reframing, of attentiveness, and a poised mind on what do I do? How do I relate to the world around me in a compassionate way that resources the other and myself? So we're excited to tell those stories and create those models. And I think without those models, um, we can, as a society, unfortunately, use well-being practices like compassion as an episodic triage that will really never permeate our internal culture or our collective culture.
mm. You know, what I love so much, Stephen, is that, you know, the work that you're doing, you know, you're showing demonstrable shifts just bringing in this education, not just education, but helping people forge these types of behaviors, where we are connecting from a place of compassion. I really love the distinction between empathy. Empathy, most humans have a level of empathy. It's what, it's what keeps us together in society to a certain degree. But what I really find interesting and incredibly important is your distinction that it's compassion. It's that compassionate action that is the key to societal civilization itself. Right. And human flourishing. That's what you're seeing, out in the different groups or enterprises or even human healthcare systems where you've come in to actually bring some of these incredible programs that's been developed at the Institute. So when we talk about AI, what can we do? What can we do when we're looking at those that are creating AI? I mean, we're still in creation. I like to say, the future isn't built just yet. It's our future to build. So, if you could make a recommendation to those of us that are building these solutions or still building these technologies, what could we do to what's the one thing that you'd like tomorrow for us to bring more compassion into AI? What would you ask us to do?
Mm. Uh, I feel like I'm dribbling the ball in front of a group of Michael Jordans, so I'm going to apologize because you're all the experts. I think dialing in to the experience of compassion, because when we experience compassion, something tremendous happens. It can be a small action when somebody holds the door for us, or we've had a difficult time, but somebody does something. They put a post-it note next to our desk and says, "Hey, do you need dinner warmed up?" That's compassion in action. And what happens experientially is this tremendous human connection and pro-social feeling. So building that in so that it's understood what compassion is, like what's the street value of it? Um, what do we take forward in our life in building structures in that allow that to flourish is really key. I live in San Francisco, and there's a street I drive on all the time, notorious 19th Avenue, and it's traffic is very difficult, and everybody's competing, getting down this lengthy road through light after light after light after light. I always some of the more conservative folks in the well-being community who think that AI is could be the death knell of well-being. I always remind them that it's the Waymo car that will allow me to merge. And it allows me to merge because it acknowledges I'm there and it defers to me and where I'm at. So even simple ways, so even that was a very simple act of deference, protecting the Waymo car so it doesn't get in an accident. But the refraction of it is I have the experience of acknowledgement. I'm given relief. So that's what happens when we experience compassion. So dial in to the pro-social, the fact that human connection, meaningful human connection, um, supplemented by AI, supplemented by technology, the way it has been for millennia with different types of technology. But at the end of the day, it's human connection that we want. Making that primal is, I think, really important. And I think it can be done in amazing ways. I'll give you another example that comes direct from our work. We work with a lot of physicians. Clinicians are at tremendous risk of burnout. We're having an epidemic with what's happening in the US in healthcare right now, where we're losing more and more physicians, we're losing nurses, sadly, some of them to suicide. If you look at the numbers, and it's terrifying. If you look at the numbers of people who are leaving in their 40s after having done decades and spent tens of thousands of dollars, hundreds of thousands of dollars on education, making the decision to leave the profession is a huge problem. one clinician I spoke to told me they're so excited about AI. And the application they love is the notation that's happening in the room when they're with patients allows them to be more present as a human being, to achieve the human outcome, both for themselves and the patient, which has a reflection on the family. When the patient leaves, they're more held. The space is able to hold them. The physician's able to hold space better because AI is taking those notes, and they don't have to be multitasking and sidebarring their attention to the clinician. So these are ways where compassion becomes real. So I think breaking down what is the human reality, and looking at those ways that support pro-social behaviors and meaningful human connection and sustained human connection. I think those are the best things we can do.
No, I love that. And um, you know, when we look at the possibilities and the opportunities, one of the things that I thought was phenomenal that you were talking about yesterday is that there's only so much you can do today, right? You're only going to be able to reach with your team and people, to be able to bring these programs, and especially you're absolutely right. So, enough of us are talking about there around the world. There's an epidemic right now. There's a mental health epidemic. If you look at a number of the studies, the surveys, Harvard and Queensland University came out with a study over 50%, well over 50% of adults around the world. This is a global study, very comprehensive, are either suffering from mental health syndrome or we expect will have one in the next 5 years, a syndrome, right? Not just, hey, I'm feeling really down, an actual syndrome. That's over half the population of adults around the world. And then when we get to younger folks, over 20% of young men don't have a single friend, not one friend, and over 50% of men across demographics are unhappy and not feeling connected to their friends. 30 years ago, this wasn't a problem. And so, one of the things you were talking about is, you're exploring, the Institute is exploring how to responsibly, ethically,
Mm.
and mindfully integrate AI into this important work that you do. So can you tell us a little bit about that and your decision on that? And how can we all, this entire conference is about compassion and AI. So how do we make sure this is not just a theme, but as a movement that grows? What's your recommendation there? So two questions.
Oh, yeah, no. Well, I first just want to applaud all of you because you're having I feel the conversation of the moment. You mentioned data, Ani, which I fully agree with you. I mean, if you start to look at the data, it's deeply sobering. The Muhammad Ali Center here in the US released a report at the beginning of the year on compassion. Um, it's as always, it's a good news, bad news. 61% of Americans say they feel a decline in compassion in the last 4 years. Yet 70% of them express a desire um, for reduced aggressive political rhetoric. So even in the numbers, we're seeing this natural inertia towards compassion. What's interesting too is I think you're at the your folks in your community are at the zeitgeist because that same study found out compassion related on-site online searches went up 4,000% over the last 5 years, showing that people are dialing in to a meaningful sense of compassion.
Mm,
So I think going to the second part of your question, which is really how do we do this going forward? How do we bring this in? Um, at the end of the day, compassion has to support sustained, meaningful human connection. So leaning in to the fact that we a lot of the suffering we're seeing is from a movement away from meaningful human connection. There's a moment here, and I feel an alchemical moment with AI that gives us the chance to rewrite how we relate to technology and how technology functions in our humanity and functions in what an acknowledgement, as you pointed out, that we need to surface well-being as a deliverable. I think AI has the potential to be done in a way that can get us to a more meaningful understanding of meaning. When I say meaningful, I mean a felt experience. It's not lip service, it's not conceptual. It's conceptual, but it's felt. We experience it at the level of the day. Similar to the Waymo letting me merge, I felt the relief in that. So I think there's a moment here where AI can actually contribute to creating a deeply more human and healthy relationship with technology that I think wasn't there in the early days of the internet. I think the aspiration of connection was there, but we've seen a lot of aberrations that are not meaningful human connection. So I think there's a way to maybe bring AI in to right the ship there, and I think that's a huge moment. But I think you're acknowledging that if we continue to rely on technology in a way that pulls us away from meaningful human connection, we're going to continue to suffer. We're going to feel distance. It's going to be harder to relate to the suffering and the happiness of others, which is the common ground of common humanity. So anything that brings us back to that is key. And so I think there's an opportunity, but it's also a challenge.
Oh, thank you so much, Stephen, for your wisdom, for helping weave together, so much of what you're doing today and what you've been working on and your team around compassion training in such a powerful way. Truly, it reminds us that this is not just about a personal practice, but it's really it's really the key to our humanity and society. You know, I deeply appreciate that. And also how this can be such a strong a strong part of organizational culture. There's some of what we've been working on at Imagine is this. So I look forward to working with you and your organization. And I encourage everyone to reach out. Um, Thank you so much also for the story you were telling of this project you're working on. We're really excited about this project, working with frontline healthcare workers that have been experiencing so much hope. They provide so much hope for others, but also experience so much as far as challenges themselves. So I really look forward to seeing what comes from that project and the possibility of making compassion actionable and those results. So thank you so much, Stephen.
Bonnie, thank you so much for having me. Thank you all for having me. It's a pleasure to be with you all. So thank you.
And we'll be sharing the link to Compassion Institute. It's just phenomenal. Thank you, Stephen.